Good evening, everyone. I'm Stephen Davidson, the Director of Public Relations and Communications at the Ministry of Health and Wellness, and I'm happy to be wearing a different hat this evening as I host this prostate cancer awareness discussion, Bossman reasoning, big people things. So I want you to get everybody to, as we discuss big people things, as part of the Ministry of Health and Wellness's prostate cancer awareness campaign. And of course, today we have some top shelf facilitators. We have consultant urologist Dr. Belinda Morrison and Bishop Dr. Carla Dunbar, and they will afford us yet another opportunity to continue our drive, our public education drive around prostate cancer, and to stress the importance of prostate cancer screening during the month of September and beyond, of course, and we're observing Prostate Cancer Month in September, and we hope as well to enhance our survivors' quality of life for those who have to do the surgery. Recognizing that partnerships form the basis for added strength, wider reach and positive impact, the Ministry of Health and Wellness's non-communicable and injury prevention unit has joined forces with one of Jamaica's largest insurance companies, Guardian Life, to stage this important conversation, and we are glad that you have joined us. We appreciate the muscle of the Guardian Group and to add to our prostate cancer awareness. And of course, their tagline is live well, live easy. And so they are making it easy for us to live well. By now, we all have learned that prostate cancer is Jamaica's leading cause of cancer-related deaths and is the most commonly diagnosed form of cancer in men in Jamaica. We also know that because the prostate is close to several vital structures, prostate cancer and its treatments can disrupt normal urinary, bowel, and sexual functioning. Nearly all men will experience some erectile dysfunction for the first few months after prostate cancer surgery. For all men having normal preoperative erectile function, irrespective of age, preservation of this function is understandably important post-operatively. This conversation will be mainly around post-prostate cancer side effects that might be experienced, and we also be talking through some couple-friendly techniques and strategies for better management of those side effects. We will now hear from our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton.
Good evening all. Let me first express profound thanks to the organizers of this important prostate cancer awareness interaction. I also wish to express my personal appreciation to our partners for their contribution. We recognize that tackling diseases like prostate cancer is not a job that is wholly the remit of the Ministry of Health and Wellness. We can only achieve significant progress if we build strong partnerships and alliances. To our esteemed presenters and panelists, we are grateful for your expertise, your time, and constancy in supporting prostate cancer awareness through your people-centered public education efforts. We look forward to the anchor point you will provide. To our survivors for being so willing to share your journey with prostate cancer in the hope that you can inspire others, thank you for your bravery. Demonstrated here this evening is public-private partnerships in action that reiterates the need to use our voices collectively as agents of change. Prostate cancer is a sizable threat to the health and well-being of the Jamaican men and is a major burden in Jamaica. It ranks as the commonest cancer in the island and is the leading cause of cancer-related deaths. The goal is to support those affected by prostate cancer and encourage health-promoting behaviors. The ministry will continue to facilitate prostate cancer education in an effort to increase men's knowledge on prostate cancer while decreasing their anxiety on the issues and ultimately shifting men's attitude towards regular prostate cancer screening. Screening is a key determining factor in bringing down the high mortality rates for prostate cancer in Jamaica. With education, appropriate screening, and a continued effort towards innovative treatments, eradicating prostate cancer is possible. Especially in this month of September, the ministry aims to spread this message, increase optimism, and provide support to those in need. Have a good session, and thank you.
Thank you, Minister. We're making this session very interactive, so we're inviting persons to go now to the Guardian Life Instagram page, Guardian Group JM, and the first person to answer the question will win a prize. Go now. We'll now hear remarks from Dr. Kathy-Ann Williams, NCD Risk Factor Program Development Officer at the Ministry of Health and Wellness.
Thank you. With each of these public education initiatives, we set clear goals. This couple session highlights the need for better information and support around the potential physical and emotional effects, both before and after surgery. Erectile dysfunction should be viewed as a problem a couple has together. With this mindset, a couple may overcome ED, strengthen their relationship, and improve communication. Our conversation with our esteemed facilitators, consultant urologist Dr. Belinda Morrison-Bligen and Bishop Dr. Carla Dunbar, we hope will inoculate couples against future problems related to prostate cancer treatment. Some men we know are able to discuss sexual problems openly, but others struggle with embarrassment. Some men find it easier to manage and adjust the physical changes they experience versus the psychological aspects. When men and their intimate partners are fully informed about prostate cancer treatment options and their possible complications, and are supported in decision-making with the inclusion of psychosexual support, better outcomes are experienced. So we look forward to hearing from our experienced experts this evening.
Thank you very much, Dr. Williams. So in public health, we know the importance of partnership, and this evening we're pleased to have the support of Guardian Life. At this time, I'll invite Mr. Glendon Gordon, Vice President for Individual Life Sales at Guardian Life Limited, to offer his remarks.
Good evening, Jamaica. Guardian Life is only too happy to be partnering with Bossman Reasoning this evening to have a conversation about prostate cancer, very important to our males in the society, whether you're young or old. Guardian tagline is live easy, live well. Ladies and gentlemen, prostate cancer is one of the highest incidents in men, and it is creating a lot of psychological problems post-surgery. And it is a problem not only for the men, but for the intimate partners and the caregivers. So Guardian is only too happy because men on a whole are afraid of doing this kind of test, first of all, because it affects so many things as far as the men is concerned. We're afraid to talk about it, and after the surgery, then it's like the whole world turns upside down. But Guardian is happy to be in this conversation this afternoon, and one of the key aspects why we are very happy to be, because it's not only the psychosexual part of it, but we believe in the quality of life. And quality of life comes with the financial part of it. And if you don't have the finance ready to deal with this, then everything goes awry. The intimate partners get anxious, the men get anxious, and the whole world is turned upside down. We have two of the best products that can cover the financial aspect of it, which is the Guardian Care Plus and the Guardian New Ultimate Provider. Now, once you have the finance ready, now this is just in case, ladies and gentlemen, we don't know, because we pride ourselves in wellness, preventative measures, but just in case, it's just like you have the car tire, you're going somewhere and it goes flat, you have this spare, and it ensures that you get to where you want to go. So the financial help will definitely prevent the anxiety, and you can have what we call the best quality of life, even after post-surgery. So there's no need to worry. So basically, you live easy and live well, even post-surgery.
many Jamaicans are having to do battle with cancer, and sadly, too many are losing the fight. In 2020 alone, our island recorded more than 7,000 new cases of cancer, and there were over 4,000 cancer-related deaths. It is important, therefore, to get the facts and take a proactive approach to screening and comprehensive treatment, which offer the best chance of a good quality of life and survival. The Ministry of Health's non-communicable diseases web pages are designed to provide you with world-class guidance and up-to-date information on cancer that is relevant to our population. They also offer actionable strategies to help you and your loved ones beat cancer.
For further information, please check out the Ministry's non-communicable disease and injury prevention website.
Should critical illness strike, don't let worry fill your head. Say hello to happiness and goodbye to worry with Guardian Life's new Ultimate Provider Plan. Secure your medical expenses in the event of critical illness ahead of time while benefiting from our investment portfolio and so much more. Give yourself and your family the peace of mind you deserve with Guardian Life's new Ultimate Provider Plan today. And live secure, live easy.
All right, so now we are joined by consultant urologist and lecturer, Dr. Belinda Morrison-Blijen. How are you, Doc?
I'm great, thank you.
Thank you so much for joining us. So tell us, Doc, what and where is the prostate?
But first of all, the prostate is a very small gland that is located just below the urinary bladder. So it's deep down in the pelvis, behind what we call the pubic bone and right in front of the rectum. It's a gland that makes secretions that come out in semen as we know it.
Okay. And so it does have a purpose, have a function.
Absolutely,
It's
it has
very
a purpose.
important.
We actually call it an accessory gland of reproduction because it helps to maintain normal reproductive health in men.
Okay. And so cancers can develop there. So tell us now, what then is prostate cancer?
It's really just an abnormal growth of cells in the prostate where it bypasses all the regulator mechanisms in that organ. So the cells grow and grow and grow and they do not die, and they have the capacity to spread locally outside of the gland or in distant areas.
Right. And so at some point in our lifetime then, the men would have to get checked. So how important is the screening and at what point do we go for screening?
So the screening is very important, especially locally, because it's our #1 cancer that we see. And of all the cancers that we see, it's the #1 cause of cancer-related deaths. In Jamaica, our men are particularly high risk because black race confers a high risk, somehow related to genetics. So we recommend that men start checking at age 40. If they're black, especially if they have a family history of prostate cancer or a family history of breast cancer, they should start checking at age 40 once every year.
Every year, okay. So I think I have a little more time left, so I could get it done. But tell us, there is also a treatment for if we are go through the screening and then we find that we are at some stage. So are there different stages and then what's the treatment?
Absolutely. So screening is a term that we've introduced, and really it is early detection of disease. It's detecting it before there are any symptoms. Surely we want to pick up prostate cancer when it's very early, before a man has any symptoms, and that would be the earliest stage. And yes, it can be cured. And I always like to emphasize that to people to understand that prostate cancer can be cured at the earliest stage. This may be either with surgery or with radiation. With advanced stages, there can be treatment, but we do not classify it as cure. And by advanced, I mean prostate cancer that has spread to the bones, unfortunately, spread to lymph glands. We can't necessarily cure that kind of disease, but we can aim to control it.
Okay. And so there is what you consider life after prostate cancer or during?
Absolutely, absolutely. I mean, in medicine, we talk about 5-year and 10-year survival, and it just refers to the number of persons who are treated who are alive at 5 and 10 years. But for those of them who are diagnosed with early stage prostate cancer, we're talking about 5 and 10-year survivals way over 90%. And that just means most persons who are diagnosed with early stage prostate cancer can be cured, and there are lots of men walking around to tell the tale.
Right, and we are thankful for all those who have survived.
Yes.
But one of the concerns of men is erectile dysfunction, which comes as a part of this. Is it for the surgery, after the surgery, or a part of the treatment?
Well,
it's a side
men
effect.
are always concerned about their erections, right? And rightly so, because we as women want them to be concerned. We benefit from them. However, erectile dysfunction can occur from the moment of diagnosis.
Okay.
You picture a man coming into my office, and I have that onerous responsibility really to say, listen, you have prostate cancer. That's awful. It shocks them. There's a lot of fear about their mortality, about whether they will perform sexually, of their role in their relationship, of their finances. Can I afford this? How is this going to impact me? What am I going to tell my friends? And so there's a lot of fear from the moment of diagnosis. And so men can have what we call psychogenic erectile dysfunction just from that moment. They just have no interest in sex. Sometimes their libido or desire or drive goes. And what I find a lot is that some men go through this journey on their own. They, for some reason, do not present with a partner, and so they don't appear to have an outlet to share and to discuss. And even sometimes when they come to you as a doctor, you try and open up with them, they're not ready to open up. And so this affects their desire and their erections. And then we move on to the next stage of treatment, where there are valid reasons for their erectile dysfunction, regardless of what the treatment is, whether it be surgery, whether it be radiation, or whether it be hormonal therapy, which we give for advanced prostate cancer. They can get erectile dysfunction. So many people speak about erectile dysfunction in relation to surgery. And yes, as a surgeon, I can admit it is a risk, but certainly can occur with any type of treatment.
Okay, and as you mentioned in terms of having that kind of a support, so outside of a medical, support, what would you say to couples or their partners? How can the female partner support?
Well, first of all, the men have to tell their partners. Sometimes the women come in months after treatment and say they have been trying to get information, they can't get it, they've been blocked. So the men need to understand that they need to be supported through the process. So if they have a significant other, they need to open up with them. I would say most women are generally supportive, and they will walk through the process with the men. I think most men are so afraid of not being able to perform sexually, they're afraid to even share with their spouses for the fear that, it may affect their relationship. And most times it's the reverse. So I think, first of all, they have to have that level of support. They need to understand that as doctors, we can provide support, whether it be in a basic level as a urologist, or even referring them to therapists and counselors who can give them some more in-depth help. There are support systems available in Jamaica through the Jamaica Cancer Society. There's one big support group there, and a newly formed support group called Brothers United Against Prostate Cancer, which is a group that comes out of the Webster Memorial United Church Men's Fellowship. So people need to understand that they need to talk and share what their concerns are. And as a physician, I'm willing to share all the various issues that can occur. And luckily, we can also speak about the ways to treat this condition.
Okay. So there's no reason for us to tough it out and man it out, right?
It never ever helps. And I think the anxiety that is generated makes them even, in a worse position, really.
Okay. And but there's also rehabilitation. So
Absolutely.
There's work that can be done to get us back to the place, if that should be one of the effects.
And what I will say as well is that there's so many factors that will determine the outcome of the erections. If we speak specifically about surgery, which is performed quite commonly by us as urologists, the main reason for it is the fact that the nerves that give rise to an erection run very close to the prostate, almost like my dress hugging my thigh, right? And so in that situation, when we are operating, it's a very technical operation to try and remove that prostate, but yet spare those nerves. And it's something that we have to do, and we aim to do it in every case, unless there are surgical factors that prevent it. But apart from that, we have to look at the age of the man. Older men naturally will have poorer erections after surgery. for various reasons, erectile function declines naturally as men get older. There are also certain medical conditions that can make erectile function poorer. Diabetes is a major one, hypertension or high cholesterol. And so these non-communicable diseases on their own are independent risk factors for poorer outcomes after surgery or even after radiation when it relates to erectile function recovery. And then, of course, if a man doesn't have good erections before surgery, as good as we are, we can make it better after. So naturally, the erectile function will decline after surgery. But the good thing is there's something called penile rehabilitation. And it's just a big term for getting that erection back. Now, we can get it back with the use of medications. We can get it back with the use of medications taken either as a tablet or an injection in the penis. And we will go as far as the man is willing to go to get those erections back.
All right, thank you very much, Doc. We have to come back to you. We're getting more information, but we have to take a break, so we'll be right back.
Too many Jamaicans are having to do battle with cancer, and sadly, too many are losing the fight. In 2020 alone, our island recorded more than 7,000 new cases of cancer, and there were over 4,000 cancer-related deaths. It is important, therefore, to get the facts and take a proactive approach to screening and comprehensive treatment, which offer the best chance of a good quality of life and survival. The Ministry of Health's non-communicable diseases web pages are designed to provide you with world-class guidance and up-to-date information on cancer that is relevant to our population. They also offer actionable strategies to help you and your loved ones beat cancer.
For further information, please check out the ministry's non-communicable disease and injury prevention website.
Should critical illness strike, don't let worry fill your head. Say hello to happiness and goodbye to worry with Guardian Life's new Ultimate Provider Plan. Secure your medical expenses in the event of critical illness ahead of time while benefiting from our investment portfolio and so much more. Give yourself and your family the peace of mind you deserve with Guardian Life's new Ultimate Provider Plan today. And live secure, live easy.
Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right.
Welcome back to Bossman Reasoning, Big People Thing. So Doc, we were talking about the surgical techniques. Can you tell us more about that?
Sure. So over the years, I think a lot has been learned about the anatomy of the prostate and the adjoining structures. So what is done with each operation, whether it be open, whether it be robotic, or whether it be laparoscopic, is what's called a nerve sparing operation. This is where we spare the nerves that go to the penis to provide stimulation for the vessels to get an erection. All doctors who are trained in urology know how to perform a nerve-sparing operation. And it really doesn't matter what mode of radical prostatectomy is done, which is the surgery. So that certainly helps. And I will say, yes, even after the operation, most men will find that there's some temporary decline in their erections, but some men have recovery as early as weeks after an operation. Much older men may have recovery a lot later, especially if they're over age 55 or 65, if they have the other illnesses such as diabetes, hypertension, or high cholesterol. And they may require more assistance in terms of rehabilitation to get the recovery, but it does happen.
Okay. And I know there are some concerns as well about infertility. So how do you address those concerns?
So it's natural with this surgery. I mean, sperm is made really within the testes, so those are not affected with this operation. However, by nature of what is done at the time of a prostatectomy, the prostate is removed, the seminal glands, which is a paired set of glands adjacent to the prostate, is removed. Those two structures make up about 95% of semen, and the tubes that will carry sperm out, at least forming the ejaculatory ducts, those are tied off. So essentially, at the end of this operation, and if a man has sex and he ejaculates, nothing will come out. So he will not be able to have a child in the normal way. What we generally recommend to our men who are still interested in having children after the procedure, especially if they do not have children before, is to bank their sperm. And we have the option for that at the Hugh Winter Fertility Treatment Unit at the University of the West Indies.
Okay, great. So there is hope, Doc.
Absolutely.
So once you come into your office, what words of encouragement do you offer to all of your patients?
First of all, I tell men that the test is very simple and it is painless. It should be done once they're at age 40, once every year. And if unfortunately cancer is diagnosed, we prefer to diagnose it early where men can be cured, and the outcome is always good. They may have a temporary, brief period of side effects, whether it be erectile dysfunction or urinary incontinence, but that will improve with time, and patients have to work with us to get better.
All right, thank you so much, Doc. And of course, men, you heard it, we loved ones as well. The expert, you heard it from the expert, and of course we want you to get screened, just man up, talk to somebody, talk to your doctor, and get it done because it's important.
Men and their loved ones should be proactive about prostate health year-round by being aware of the risks and symptoms and regularly seeing their healthcare provider. If there's one thing that is certain about prostate cancer, it is that early detection is key to reducing the death rate associated with the condition that has many men cowering in fear. For us men, screening must therefore be our #1 priority. It is not when I have time, but rather I must make the time. Prostate cancer screening is simple and should be routinely performed beginning at age 40 years. We have to rid ourselves of the notion that doing the digital rectal examination is not manly. That kind of thinking can lead to our death. Prostate cancer is not a death sentence when detected early, which is why death is so painful. Men, we need to take care of ourselves. At your next doctor's visit, if you are over 40, ask your doctor to perform a prostate cancer screening. Let us all generate awareness about prostate health by encouraging our Bossman crew to learn more about our prostate cancer and talk with their doctors about their risk.
Should critical illness strike, don't let worry fill your head. Say hello to happiness and goodbye to worry with Guardian Life's new Ultimate Provider Plan. Secure your medical expenses in the event of critical illness ahead of time while benefiting from more investment portfolio and so much more. Give yourself and your family the peace of mind you deserve with Guardian Life's new Ultimate Provider Plan today. And live secure, live easy.
Too many Jamaicans are having to do battle with cancer, and sadly, too many are losing the fight. In 2020 alone, our island recorded more than 7,000 new cases of cancer, and there were over 4,000 cancer-related deaths. It is important, therefore, to get the facts and take a proactive approach to screening and comprehensive treatment, which offer the best chance of a good quality of life and survival. The Ministry of Health's non-communicable diseases web pages are designed to provide you with world-class guidance and up-to-date information on cancer that is relevant to our population. They also offer actionable strategies to help you and your loved ones beat cancer.
For further information, please check out the ministry's non-communicable disease and injury prevention website.
Hashtag, we love our men healthy. Hashtag, we are his champion. Hashtag, women for prostate health. It's no secret that men are oftentimes reluctant to visit the doctor. It's even more of a challenge to get them to initiate discussions with their doctors about prostate cancer screening. With September as Prostate Cancer Awareness Month, I am more mindful that we as women have an invaluable role to play in urging the men in our lives, our fathers, our brothers, husbands, sons, to get screened. As family units, we need to educate ourselves about the disease. For example, men with a father or brother with prostate cancer are twice as likely to develop the disease. We also need to be aware of the factors that can reduce the risk of prostate cancer, such as not smoking, reducing alcohol consumption, as well as embracing healthy eating habits and regular exercise. Should there be a diagnosis of prostate cancer, we must be there to offer care and emotional support as we journey with our men through the various forms of treatment, while inspiring in them confidence that their champions are by their sides. Ladies, usually we serve as the key decision makers when it comes to the health of our families, whether it's selecting a physician, deciding on treatment options, or taking steps to prevent the onset of illness. It's a role that carries with it the awesome responsibility for making informed decisions that give our loved ones the best chance of a good outcome and enduring health. Have an open discussion with the men in our lives and help ease the fear around screening, as screening saves lives.
All right, welcome back and thank you for joining us for Bossman Reasoning Big People Things. And we're into the Big People Things segment. And of course, prostate cancer, the journey, you need support. So we're talking about couples and how we can support your partner along this journey. And of course, we have the expert with us, sex therapist, marriage counselor, Bishop Dr. Carla Dunbar. How are you?
I am blessed. I'm honored to be here, like being among the guys.
All right, thank you. And of course, September is Prostate Cancer Month, so
Right.
you're going to help us through this journey.
As much
How
as I
important is communication when the male is experiencing erectile dysfunction?
It is critically important. You know, your partner is a person you share your closest with. You know, and so it's important that you can talk to your spouse about what is it that you're experiencing during these times. You know, you're having a lot of emotional upheavals, you know, you're having anxiety, you're having issues with fears and insecurities. So you need to be able to communicate to your partner how you're feeling, what's happening, so that you can actually have the support.
All right, so right throughout the relationship, communication
is critically important.
It's
like
critical.
the A things, like one of the top 3 important things in a relationship is to communicate. And you're always communicating, verbally or non-verbally, but it's more important to verbally communicate. You know, we're not all mind readers here. So communicate, talk to your spouse so that your spouse can know what's happening right throughout the life of your relationship.
Okay, and Doc, we have some questions that came in online, and I want to get it right to make sure we answer the questions from the public, and of course, you are the expert here. So it says men who experience ED may feel inadequate, and it's hard to get back that self-confidence. So how do you deal with men and the lack of confidence?
Well, I have to speak with them first for them to understand that, you know, they're not the only ones going through it, and there are other persons who are going through it. It's good when persons feel like they're not alone in a situation. So you take them individually and you're able to talk them through that. And also to help them to understand that sex doesn't really, I know it defines you guys, but I mean, penetrative sex, there are other ways, there are other things. So, I mean, if it is that you're affected in this way and you're unable to function as you normally function, then as a therapist, I can help you to find other ways to function. So just to get them comfortable, just to get them to understand that your partner, you know, don't see you as just a sex object, even though you may see the person that way. Women view things differently. If you're nice and intimate and mushy with us, we're fine.
All right, so how can we reduce or eliminate an uncomfortable or conflicting atmosphere at home when you're dealing with erectile dysfunction?
Again, talk. Bedroom talk. It's important. If you don't want to talk about it around the dining table, at least talk about it in the bedroom. right? Allow for your partner to understand. It's just like when we are approaching menopause. We want to help our partners to understand the changes that our bodies are going to go through so that they don't think we're trying to avoid them and that all of that when our libido gets low or otherwise. So it's important that they also talk to us that they're having a little problem with, getting it up, them having a little bit more extra flaccidity, that kind of a thing, help us to understand what's going on. I mean, we might be cognizant of what's going on because women are very perceptive, right? And you guys are a little bit dense. But not in a bad way. But you just don't talk. But it's, your pride, your ego. This allows you from sharing this very intimate detail with us because your sexuality is your manhood, after all, right? So it is the thing, right? But it's important that you really express, you talk, open up, man, and let us know what is happening because we ladies are your best Viagra.
So the couple is going through erectile. It's a couple. It's a couple thing.
Yeah, it's not a man thing, not your thing. It's you and I thing. Your body is mine.
Okay.
Right. So yeah, you have to be careful what you do with my body. So tell me about it.
Okay. So what else can we do then to bring sexual pleasure into the bedroom if we're experiencing ED?
So many things that can happen. I wrote this book and I had to bring it. Because you guys need to see it, Sexscription. It's a prescription for sex. And it tells you apart from positions, etc., ways to be intimate, especially, or some men with prostate cancer are usually men going on their 40s up to their 50s, right, who are presenting with the illness. And so you are going to experience a lot of changes based on what's happening. So you need to be more intimate. Stop focusing on the things that you used to do when you're 20. Don't try to get it back. You don't need to get it back, right? You need to go forward. Be more intimate. Be more because intimacy is more intense. And intimacy is not just sex, right? So there's a lot of foreplay and coreplay and more play to go on. There's oral sex. If you believe in that, that's okay and good too. I mean, I'll teach you wonderful ways to have delicious, yes, all of that going on. And it's right here, so that can happen. Talk, cuddle, just spend time together, intimate time, quality time with each other. And you'll find that you don't need to necessarily get it up. Somebody said, well, I said it in my book, the tongue is mightier than the sword. So therefore, you can apply those things. You can introduce toys. You can have games. It's okay as long as it is mutually consensual between both of you. And you don't need to feel ashamed or be ashamed about it. But I know it's critically important that you are able to stand on all 3 feet. But if that's not working out,
try something else. And you'll help us to do it.
Sure.
All right. So another question from online. It says, ED is tough on partners, sometimes making women feel unattractive, undesirable, or like they're doing something wrong. How important it is for couples to discuss their feelings?
Again, it cannot be overstated. Women tend to feel insecure even if unfaithfulness takes place in a relationship. We look at it to say, what is it that we have done wrong? Where did we fall short? What did we not bring to the table? Forgetting that we are the entire table. But all of this, right? And so we need that validity. We need to be reassured that it is not really us that is causing that, right? And it's not that you're finding us unattractive or anything like that that would have created the challenge, but the challenge is a natural challenge of aging, right? And not taking care of your health as you are supposed to. So that's why these guys need to go and do the prostate cancer test, right? Don't be afraid of this little rectal thing. Right, that's over in a minute. So it's important that you talk. It's important that you dialogue. It's important that you share, with each other. You're supposed to be supportive. You're a team. Marriage it's a relationship, not a situationship. You understand? So it's something that we partner together. Your joy is my joy and your sadness is my sadness. And the fact that we are having ED together, or we are experiencing prostate cancer, or we are experiencing menopause, it's a we thing. Okay. Yeah, marriage is not a I, me, and my. It's a we, us, and our.
It's a we thing. And we think, and going into it, we think one way, and then we book upon this.
Yes.
So how open-minded should we be?
So we should be very, very open-minded. It can't be that we are doing stuff that we can't talk about. It's the same thing with sex. We will have sex till we are blue in the face, but we never talk about it. We should. You understand? Talk about the joys. Talk about when it's all right. Talk about what you can do. Just be very sensitive, when you're talking about it. So that be very tactful. Our men you guys are the ones who are not very tactful. But sometimes you can find a 1 or 2 women who are not tactful. But just be tactful. And us ladies have to understand that when we are talking to you about your sexuality and the lack thereof and your functionality, that we must be respectful of how we speak to you, because this has a lot to do with your total makeup. right? And in the same way, it's important to just share. It's important to talk. It's important to be open, to be very transparent with each other. After all, you know, if I'm the person seeing the most grotesque expression on your face when you ejaculate, I need to know everything.
You know everything. Okay, so what is your message to wives now in support of men?
Be their support. Men want, they need our moral support. They need our support on everything, and especially if their age is declining. When my husband was approaching midlife, you know, and he was going through his thing, I had to be there. Like I said, we are the best Viagra. So, I mean, if we are there supporting you every step of the way, if it is that we realize that you're experiencing some amount of flaccidity, it is for us to motivate you. It's for us to tell you after the sexual experience, babe, that was good, you know, I enjoyed it, so that you feel like you're still functional. And that can also help you, because when your confidence is boosted, when your confidence is lifted up, it can also help to change your ED, especially if it's a emotional ED and not something that is physically related. You understand? Because we can have circumstantial ED as well, coming out of whatever situations we're facing, unemployment or whatever. So if it's mentally related, then us boosting your confidence and telling you that you were good in bed and you know that you did well, and even if we never had sex and you did a good bout of oral sex and it was great, or if we just kissed and hugged and cuddled and we feel good, that we express that to you, and that will help to build the confidence of the male. So women, you need to big up your man them. Talk truth. You need to big them up. You need to tell them, you know, what they are doing good, what they are doing well. They can't be getting everything wrong. And so we must be each other's best support. We must be the cheerleader, the lead cheerleader in the relationship to motivate them. And around this time, where they need to go and get tested, not just this time, it is us two supporting them. I have never allowed my husband to go alone to do his prostate cancer test. I am always there with him. As a matter of fact, every time he's going to the doctor, I'm there. I want to know what's happening.
What's going on, right? And Dr. Morrison would have said that most times the men, they come alone and they don't share, they don't tell. Right. So what signs can wives look out for, you know, if something is going on with the husband?
When they get withdrawn and they have always been not talkative, and so when they get even more withdrawn and they are keeping to themselves and they are not initiating sex, all of these kinds of things are signs, you know, because men are the initiators most of the time. So when you see that not happening, I had a client who, after 7 years, and his wife said, 7 years he has not touched me, and he said to me, we have stopped procreating. I realized something was wrong. You understand? Because that can't be the reason for you not touching. So when they have stopped initiating, they're not initiating as often as, it may mean that they're experiencing a challenge and they do not want you to find out because they're embarrassed. So if it is that you look for these signs, we must be very aware and alert in a relationship to pay attention to these signs in our partner that tells us that they are going through something that we may not know. And a good woman will know.
And a good one will know. All right, so together now, how important is emotional well-being for the couple when they're going through this experience?
It's totally important, because we cannot separate our emotions from who we are as people. We are tripartite, right? And we can't separate our emotions, and our emotional well-being in a relationship is critically important. It's so much more important sometimes than even the physical. Because this is where everything comes together, especially for a woman who, even the Bible tells us, we are very, very emotional. We are weaker emotionally, not necessarily physically. And so it's important that we get that emotional well-being in. And that is why it's important to talk and to share and to be transparent and to, you know, bounce off on each other and support each other in everything. I mean, like every single solitary thing. My husband and I are going over 45 years, but we are still in love with each other. We talk about every single solitary thing. And it's not that we never have problems. So I know problems sometimes will cause you to pull away from each other. But we have to remember, so we have to come back, right? And we need each other in order to survive the relationship. So the emotional health and well-being of couples in a relationship is critically important. That is why somebody like myself, as a marriage and family therapist, can help you to get back on track or to navigate the path. And if you're riding on the rims and it's a bumpy experience, I can help you to get back together.
Doc, you have given us some useful information. I want you to close with your one line to the men. What's your one line advice, and what's your one line advice to the women?
Men, your sexual health is your responsibility. Get tested for prostate cancer. If you want to function properly in the bedroom, you have to do it, right? It's important. And share with your wife. She is your support system. Ladies, support your men morally and otherwise. Just support them. They need your support. They may not say it because they're trying to work it out themselves, but you are their best cheerleader.
All right, so we want to say thanks so much to Bishop Dr. Carla Dunbar. I couldn't have said it better. That's why we brought in the experts. So we have to give that support, the men, and our wives as well, to support our men on this journey.
Last year, I spoke about advocacy. This year, I want to talk about brotherhood. If our goal is awareness, men who have had prostate issues need to spread the word, need to be their brother's keeper. They need to say, hey, this is beatable. Hey, here is what I did. Here is how I dealt with the fear, the nervousness. This is what I did.
Too many Jamaicans are having to do battle with cancer, and sadly, too many are losing the fight. In 2020 alone, our island recorded more than 7,000 new cases of cancer, and there were over 4,000 cancer-related deaths. It is important, therefore, to get the facts and take a proactive approach to screening and comprehensive treatment, which offer the best chance of a good quality of life and survival. The Ministry of Health's non-communicable diseases web pages are designed to provide you with world-class guidance and up-to-date information on cancer that is relevant to our population. They also offer actionable strategies to help you and your loved ones beat cancer.
For further information, please check out the ministry's non-communicable disease and injury prevention website.
Should critical illness strike, don't let worry fill your head. Say hello to happiness and goodbye to worry with Guardian Life's new Ultimate Provider Plan. Secure your medical expenses in the event of critical illness ahead of time while benefiting from our investment portfolio and so much more. Give yourself and your family the peace of mind you deserve with Guardian Life's new Ultimate Provider Plan today. And live secure. Live easy.
Adults to 30 minutes activity daily. Love your body, treat your body right. Vegetables, make sure you eat plenty. Children do 60 minutes activity daily. Drink some water when you feel thirsty. Cut down dessert and have a smoothie. Jamaicans, love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right. One more time now. Love your body, treat your body right. Love your body, treat your body right. Just eat right. Love your body, treat your body right. Love your body, treat your body right.
Welcome back. So of course tonight we have heard so many salient and important points that we brought back. Dr. Morrison, just to reiterate the important points that we want to take away from this discussion.
Absolutely. So importantly, I'd like to emphasize that prostate cancer is common. It is a major cause of death, and our men should start checking at age 40 once every year. They must recognize that the test is not painful, it's very simple, and it's very, very brief. Prostate cancer can be cured, and unfortunately, though there are side effects from any type of treatment, whether it be surgery, radiation, or hormones, such as erectile dysfunction and urinary incontinence, they can be treated. Not all patients who have treatment for prostate cancer will have long-lasting erectile dysfunction. It depends on so many different things, such as their age and chronic non-communicable diseases. However, there are ways and means to treat the erectile dysfunction, whether it be with tablets, whether it be with injections, or even with something called a penile implant. So I want to emphasize that men should get tested and get tested now.
All right, thank you so much, Dr. Morrison. And of course, men, remember, there is help, there is hope.
Next week, Tuesday, I have a date. It's a date with my doctor. I'll go to get my prostate checked. And I encourage you, brothers, please, let us go and get our prostates checked. God has given us many gifts, And one gift we celebrate is that of family. Our daughters, our sons, our brothers, our sisters, the women in our lives, they want us to be around. A prostate check takes only 15 seconds. 15 seconds can make a world of a difference. So join me. Get your prostate checked.
This special broadcast is brought to you by the Ministry of Health and Wellness and Guardian Life, supported by Television Jamaica. Thanks to our facilitators, Dr. Morrison and Dr. Dunbar. Stay safe, everyone.